everyone. I see a lot of familiar faces, so I'm very excited that you're here. And like Vicken said, I'm here this time to talk about the pilot in Dsegh, but specifically some of the lessons learned, and I'm going to take a slightly different approach, because those of you who know me know that anytime I talk about data, I can talk for hours. So the theme here, and the point that I want you to walk away with, is we can do better. And why is it that we are not doing better? I'm going to take a slightly different, deeper approach. But first, I do have to tell you what the project was, or is. So the idea was, or is, to do a pilot, which is a bad word in Armenia, I've learned, to do a pilot in the Dsegh and focus on diabetes and hypertension, which are some of the main drivers of morbidity and mortality in Armenia. We had a lot of stakeholders. I don't have ACP here. Sorry, Renee. I usually have it up there, but they're one of our stakeholders, so sorry. My mistake, mea culpa. But we had some planned interventions with practical trainings, pre- and post-tests, and monitoring tools, which we don't see too often in Armenia. We see it with ACP and a number of other programs, but not many. We had point-of-care testing and labs. We had medications provided by the state. So many of you may know that in Armenia, we will stent you if you have an ST elevation and MI, but we won't give you the statins ahead of time for free to prevent the stenting. Let that sink in for a second. We had practical tools that are easy to use tools for providers, doctors and nurses. We created our own quality indicators that were not just process, but outcome. Patient-centered care is key. We had a social worker and a psychologist 1 day a week working with the patients who needed it most. Some of you might say, that's not medicine, that's not healthcare. You can increase metformin and insulin all you want. If there's stress in that person's home, if there's emotional abuse, if there's physical abuse, if there's poverty or insecurity, you are not going to control the diabetes. That's why the integrated care, which is an international standard, is so important. Never done in Armenia before in this way. And of course, the way we approach the patient. So let's talk about hypertension really quickly. Hypertension leads to heart disease, leads to strokes, kidney disease, you name it, right? And what we wanted to take a very quality-based approach, so we won't go into it here, but there are 7 main components of quality per the WHO, and we tried to integrate all of them. We also, for those of you who are in love with the Libaridian model, we looked at those 3 components as well, and really looked at some of the missing systems, what we see in the red box on the right. We collected data. Like those of you who know me know I love data. We had very clear process and outcome measures. We had a lot of difficulty collecting it because ARMED is often overwhelmed. We had a lot of difficulty communicating it because many people don't focus on data and how you then use that data to improve things on a national or even larger local scale. But we did that as well. We were successful. A lot of our indicators are now part of the new sets of indicators. We are continuing. We see changes that have come not only due to our pilot, but other work being done by colleagues as well. But we could have done it better. And why didn't we? And I'm going to say something here which I think many of us know. We had COAF doing work with our integrated care workers. We were trying to do work with the local community, the Dsegh workers, ARMED, who's overwhelmed, the state health agency, who makes finance decisions and sometimes health policy decisions, the Ministry of Health, the Marzbedaran. But what we saw is that we are all isolated. What we really wanted to do from the beginning would be to have, look, we're doing a pilot, we think it could have national impact, we want to learn from our mistakes, we want to spread what works, we want to improve what doesn't. That takes regular meetings to plan it out from the beginning. But what we had was months and months of waiting for a response on a single question. It is not months and months of saying, we need you to talk to you, and here's the evidence, and it doesn't happen. Whether that's a resource issue, I don't mean financial, we had the finances. This is no longer about money. It's about, do we have the human resources, the human capacity, the human prioritization to do it? What we really needed was communication, teamwork, and a shared vision. Now, I'm not saying we had all the money in the world, but if we had had this in the way we needed it, and there are a lot of reasons that we didn't, but if we had had this, we could have gone, so much better, so much faster. This is what we need. We need to be working together, collaborating, sharing, and being transparent about what doesn't work. Not hiding something that doesn't work, but saying, hey, I can't figure this out. I'm having trouble. Can we figure it out together? And I think with that, which will be huge because it will take a huge shift in how we think, in how we work together, we can take small change, small islands of change and improvement, even with limited resources, and have a major